Good morning, everyone. My name is Joe Moscola, and I am the Executive Vice President for Enterprise Services at Northwell Health. Delighted to have you all joining us today, and I am thrilled to be joined with some of our healthcare heroes, a combination of Northwell nurses that are upstate New York right now, as well as leadership from two organizations that we have the great honor of being able to support at this point in time. And so I'm joined by Karen Zamansky. She's a nurse and the Senior Vice President of Nursing at Erie County Medical Center. In addition, Karen Keaty, who is the Chief Nursing Executive at the University of Rochester Medical Center. Good morning to both of you. And then also joined by two of the Northwell nurses who have been deployed over these roughly last 2 weeks. We have Rudy Zamore, who is a nurse from Northwell, deployed at Buffalo right now at Erie County. And then Brendan Mcdermott, a nurse for Northwell, deployed at the University of Rochester Medical Center. And so good morning to all of you. Thrilled to be sharing some of, as I said, Northwell's finest with you all. We have been incredibly grateful to have an incredible team of nurses who, when we ask for help because we want to help others within the healthcare industry, they immediately raise their hands. And from Rudy and Brendan, that's certainly what we saw, and that's who you'll be talking with today. In the beginning of the first COVID wave, Northwell was incredibly hard hit at truly the epicenter of the epicenter. And when we reached out to for help, the community of healthcare really came together. Proud to say that the University of Rochester is one of the first medical organizations that sent team members our way. This was in the early part of 2020. We were truly grateful for that delivery of expertise. We've also had other organizations at that point in time that helped us get through some of the roughest patch for us, and that was Intermountain Healthcare in Utah. You can't underestimate the power and the value that this has, not only for the receiving organization in terms of staff morale and the ability to care for our patients in the way we know how and the way we know we need to, in terms of having safe staffing levels, but also on the sending facility. This gives us great pride to be able, in certainly this example, to return the favor to Rochester. And in many ways, after our surge had passed, we were very anxious to return that favor. So we've deployed team members pretty much around the U.S. We've deployed team members internationally. We've created partnerships amidst COVID that have allowed us to move team members from time to time into areas that are being the hardest hit. Just about 2 weeks ago, that was certainly true for upstate New York. And so deployed on December 11th were 16 of Northwell's team members, along with 2 administrative leads that will be returning home tomorrow in advance of the holiday weekend. And then likely, I'm sure, jumping right back on the line down here and downstate New York. And so with that, I will turn it over to some of our team members.
Well, I'll say that we are extremely grateful for our collaboration with Northwell and for the help of the nurses that came to University of Rochester. We never expected to have you all return the favor, and it really brought a lot of positivity and really just good spirits throughout our organization to know that you were willing to send people to help us when we were also in need. The 8 nurses that came to help us, including Brendan here on the phone, have just been delightful. They hit the ground running and have helped us open additional ICU beds and also additional treatment spaces in our emergency department. So they came at the exact right time that we needed them to get a little bit of relief while our volumes were surging. And we have now had a little bit of a dip in volume, and we're hopeful that we'll be able to continue on this positive pathway as they leave us tomorrow. But we're so sorry to see them go. And I just want to say thank you for those that joined us and really have infused a lot of positivity into our organization, as well as helped us care for our community in this very busy time.
I also wanted to state how very humbled we were And the words of kind and compassion don't even really touch the emotion in which the surge occurs and in which we are responding to it. The nurses from Northwell did build our spirits, did build our morale. We were able to share clinical knowledge and learn from each other. And that's something that we will hold dear to our hearts. And we will always remember their phenomenal dedication to coming to us. And when I hear the word Northwell, which already has a large footprint in healthcare, I will always remember them as kindness, compassion, and stepping forward and giving forward to others.
Good morning, everyone. My name is Rudy Zamore, and I'm a nurse. I work with Northwell Health, and I specialize in ED, and my time here has been amazing. The staff has made the transition seamless. We always had someone available to help us, whether it's with protocols, policy. The staff has really helped us transition and able to make our stay, very comfortable. And we also were very appreciative of Northwell for allowing us to do this opportunity and still give us time to go home for the holidays. The patients also are super appreciative, and that made this stay that much more heartfelt, because we know that we're here to help a community, and everyone was welcoming, and we met so much different people and we shared clinical knowledge, as said earlier, and this experience has thus far been very great, and I'm happy that I took this experience.
And my name is Brendan Mcdermott, an ICU nurse from Northwell and Long Island Jewish Medical Center. When we came here on last Saturday, it was a more than welcoming greeting that we got from Karen Keaty and her staff. Welcomed us to the area, let us know how supported and grateful they were for us being here. And since then, it's been a fantastic experience all the way around. We are all very grateful that we're going to have the opportunity to be home before Christmas, as I think we all miss our families and are anxious to be able to spend the holidays at home. But we'll absolutely miss the experience that we've had here with the University of Rochester, with their staff, with their patients. It has been a unique, and I am very grateful for the opportunity to have been here and shared the experience with my colleagues and with the staff here.
Terrific. Thank you, Karen, for your leadership and your kind words. And Rudy and Brendan, clearly, as you heard me state before, really demonstrate why we call our caregivers healthcare heroes. Really sort of putting others before themselves, their families, and really we thank you as well for representing Northwell so well, all 77,000 strong team members. I'm delighted to be joined by our President and CEO, Michael Dowling, who will also make some comments.
Thanks, Joe, and let me just reiterate a special thanks to all of you for what you're doing for people at Rochester and at Erie County. We're well aware of the experience that you went through recently. We're very familiar. We follow it pretty closely down here. And, we all thought, a couple of months back or a year ago that all of this would be over by now. But of course, as you know, that's not the case. And I'll give a little bit of an overview in a minute about what it looks like down here right now and what we kind of project over the next couple of weeks, etc. And also for the Northwell nurses, special thanks to you for your willingness to again, as many others have done, to answer the call when we ask for volunteers who want to go help others, because we're all in the healthcare business. The extent to which we can help each other, the better. We all learn from the experiences we just mentioned. Our people learn when they go someplace else. Other people learn by having them there, and we share. And we've developed relationships with a lot of entities around the country with this agreement that if they're in trouble, we help them. If we're in trouble, they help us, and that's what we've got to be doing, especially in circumstances like this. So it's inspiring to listen to you guys, and as was just mentioned, having you home for Christmas was, of course, the idea. The problem, of course, is that everybody's now questioning is how many people can we have at home for Christmas? I mean, how many people can we have together? How safe is it if we have a large group? I know my family right now, there's a big discussion going on as to whether relatives should come or not. This is the world that we live in because the transmission of the Omicron virus is accelerating, and we're also going to have to face this for the next period of time. But I just want to extend my special thanks to you, and my best wishes to all of you in Buffalo, and my best wishes to all of you in Rochester. I know the people up there. I know the leadership up there. I've been there myself many, many times. So hang in. We'll get over this. And at some point in the future, we'll be able to say COVID is being receding into the background. Hopefully that will happen soon. But my best to all of you, and my best to all of you for a good holiday, however you celebrate it, and however many people you're going to have together. So thank you so much.
Thank you.
Thank you.
Thank you, Michael. At this point, we'll take some questions relative to the deployment of staff. And then, as Michael mentioned, we will pivot a little bit to give you a little bit of an update on where we stand at Northwell relative to Omicron and COVID.
All right, good morning, everyone. This is Jason Molinette on the Public Relations team at Northwell Health, and we do have a number of questions for our folks this morning. First one's from John Harris at the Buffalo News. Rudy, this is for you. Did your experience as a travel nurse influence you to volunteer for the ECMC assignment, and what was the patient volume like while you were there?
Yes, my experience as a travel nurse did motivate me to want to come and help my neighbors. I went to a few cities throughout the pandemic, so I thought it would be great to help, somewhere so close to home. I would say the volume consisted of both COVID and non-COVID patients. Of course, we're going through this pandemic, but we still have our everyday problems that people come to the ED with. So we definitely see both things still happening.
All right, thanks, Rudy. And we have a follow-up from John Harris, which is for Karen. Karen, how specifically did these workers from Northwell Health help at ECMC? Did it alleviate some of the stress on existing staff?
Yes, it did relieve some stress on the existing staff, and they were pivotal in helping the nurses complete their care delivery, and they also were able to take assignments, so they were able to have their own volume of patients also. It was extremely helpful, and we are very grateful.
Karen, we're going to stay with you. Kevin Jolly from Fox 29 Buffalo asks, what are the biggest challenges facing the nurses as we face a surge in cases due to the emergence of the Omicron variant?
I think the biggest challenges is to have enough hands and feet to meet all of our patients' needs. The COVID patients are quite acute and need a lot of care, and many other patients have delayed care and they need a lot of extra care. So that's our largest challenge. And we are trying to do everything we can to make sure we try to meet their needs so they can meet the patient's needs.
So Rudy, I'm going to direct that question back to you as well. What's the biggest challenge facing nurses as we face a surge in cases?
Definitely, as Karen said, having enough bodies, staffing with the pandemic is, a real issue that we do face. But as members of the healthcare we know that teamwork is important. Teamwork is everything. So although we may not have the numbers that we want, coming together and helping each other definitely helps make up for it. So having the amount of people and resources is definitely an issue that I'm sure healthcare in general faces right now. But teamwork is just number one. Coming together and helping each other is going to be what helps combat that.
All right, this is for the team in Rochester. Karen, can you describe the situation on the ground and what kind of difference the Northwell deployment made?
Sure. They made a huge difference for us, allowing us to increase our bed capacity so that we could remain under that 5 to 10% ability to care for our patients. We did have to, shift some ambulatory surgery so that we could open up additional beds for our long-term care patients. But the Northwell nurses were critical to take care of our ICU patients and keep our ED flowing. So they did, same with Karen's experience in Buffalo. They were able to take assignments immediately, and they worked almost every day that they were here except for one. So they were really a huge infusion of not only great skill set for us, but also just their positive attitude and their willingness to jump in and help. And we've learned so much from them. And my team that has been instrumental in, logistics with them here, Wendy Allen Thompson, Nancy Rezegi, and Shelley Baker have just told me this morning, this has been a life-changing experience to be able to help facilitate this and see how quickly these nurses could just jump on our teams, and they were like one of us right away. So I also want to thank Brandy Fellew, who was the coordinator for these 8 nurses. She was instrumental in making sure that we assigned them properly and that they had the competencies that they needed. So they certainly were way more than helping hands. They navigated their own assignments and really became a part of our team.
Thank you. Brendan, this is for you. This is from Jenny Lai at WHEC in Rochester. What was the morale among staff like at Strong, especially dealing with this rise in cases?
Well, as the pandemic has hit everybody, it becomes more and more straining on everyone. I would have to say that the staff here at Rochester have been absolutely amazing in every way. They are a wonderful group of people to work for, work with, work side by side with. They've been supportive and helpful with anything and everything that we need. It has been our opportunity to give just a little bit of relief, or at least a little bit of inspiration that we're here to help and we will do whatever we can to help you. And I think that all in all, it's been a great experience for both sides. And the morale here is just wonderful. The staff here are really great people to work for and with.
And Brendan, a follow-up for you. Your wife is a nurse. You have children at home. Tell me about that decision to even deploy and what it means to know that you're going to be home for Christmas.
My wife is 25 years a nurse in Cohen's Children's Medical Center with Northwell. And when this opportunity was presented, my wife and I discussed it, and she said, there is no question that it is our duty to go and help. And if the opportunity is here to do it, that we need to do it. And with her support and with her help, I was able to organize myself and our family and everything else that needed to be done in order to make it here and spend our time here.
Thanks, Brendan. Karen Zemensky, Rudy Zamor, Karen Keedy, Brendan Mcdermott, thanks so much for taking the time. If you could stay on for a few more minutes, we are now going to continue on with more remarks from Michael Dowling.
And thank you very, very much. Again, special thanks for everything that you're doing. So let me give you just a little bit of an update about what's happening down here at the moment. Our numbers, and I'm now talking about Northwell in total, all of our hospitals, which is 22 hospitals. We today have 513 inpatient COVIDs in the hospital. it has been upsurging and increasing since Thanksgiving. We were at one time prior to Thanksgiving, we had dropped as low as I think it was about 140. And then it just kept going up and has increased quite a bit over the last week. It's no surprise because more and more people are getting tested. The positivity rate is going up. Some of them, end up in the hospital. It's not a one-on-one correlation. So you're going to have a lot more positivity in the community, but it's not necessarily going to reflect one-to-one in terms of hospitalizations. But even though we have 513 today, I like to put things in a little bit of historical perspective. When we were at the epicenter way back in May of last year, we had in our hospitals on a daily basis 3,500 COVID patients. And of course that dropped down, and this time, and the second wave, which was last Christmas, around Christmas of 2020, we had about 900 patients. So we today have 500 compared to 900 this time last year, compared to 3,500 in the spring of 2020. So we do expect the numbers to increase now after Christmas. We're kind of having a pool as to who's going to be right and what the numbers might look like. I think we'll be around 900 sometime in the first and second week of January. Some people think it's going to be a little bit higher. Some people think it's going to be a little bit lower. But we know the number is going to go up. For us, we can handle those numbers. We have the resources, obviously a little bit of a stretch because of the positivity rates that's occurring not just in the community but also among some staff, because we do have staff out, and Joe may want to give some numbers on that in a minute. But we'll be able to handle it. What we're concerned about is to make sure that everybody gets the booster shot. We are 100% vaccinated here, but not all of our employees have yet got the booster. So we're encouraging all employees to get the booster. And there is discussion at the state level and across other health systems as to whether or not the booster should be mandated. We have not done that, but we are strongly encouraging all of our employees to get the booster. And I assume that they're doing the same in Rochester and in Buffalo. Because we do know that the vaccine wanes somewhat. And now, of course, the other new issue which complicates all of this, because it's continually changing, is now people say that the booster wanes after X period of time. And this morning, I was in some meetings this morning and conference calls, and Israel has already moved to give the 4th shot to people, I believe it's over 60 and high-risk individuals. So that's obviously going to cause a little bit of pressure with regard to what the policies are that we should be proceeding with here. But right now we're in pretty good shape, we do have some people saying, including some of our clinical people, that we're going to have a very busy 3 to 4 weeks, and then it's going to wane and get better. We hope that's the case. I think that we're going to be playing with this for quite a number of months. It may not be at this level. It may get easier, but it's going to be around for a while, and eventually it'll be around forever for that matter. And at some point in the future, COVID is going to recede into the background, just like the way we deal with the flu these days. I know people die from the flu every year, but we don't. It's not always front and center. It kind of goes into the rear, and we move on to other things. I think that's eventually going to happen with COVID. The issue is the timing, when that will happen. So right now, we're in relatively okay shape.
Thank you, Michael, for that update. We do have some questions coming in. The first is for Joe Mascola. Joe, this is Mike Hoffman from Cranes. Does Northwell plan to restrict hospital visitation?
Thank you for the question. Yes, we've begun to restrict hospital visitation already to a degree. I think we certainly learned from the first wave the absolute importance that family plays in the healing process. And so we very cautiously make those adjustments and changes, but of course want to prevent any spread of infection from outside the hospital into the hospital, or from in the hospital to people within the community. We have for a while required proof of vaccination for anyone visiting any one of our patients in the hospital. And so the restrictions that we've put in place at this point just decrease the number of people that can visit, the amount of time that they can visit, and then the age restrictions for those visiting.
All right, and we have a follow-up for you, Joe. Some health systems have reportedly said they would stop giving patients the two most commonly used COVID antibody treatments because they don't appear effective against Omicron. What's Northwell's plan on this?
Yeah, so we have, true to visitation policy and any other type of treatment protocol, we have a clinical advisory group that meets virtually daily and has been doing so for the last 22 months. And so when these patients present to our ED, we have protocols that we follow to make sure that that patient is getting the best treatment possible. And so those decisions are made in a collaborative way and evaluated in our policies and protocols.
All right, thank you. This question is for Michael Dowling. Michael, this is Maura McDermott from Newsday. Given demand for COVID testing, does Northwell plan to expand testing, and what details can you give about that?
Yes, we are opening up multiple new sites all over the region. And the more sites that are available for testing, the better. I think everybody's going to be increasing testing sites. I also think the state will be increasing sites because as you see out there, you see the lines of people all over the place. You know, it's a good thing that people want to get tested, which of course means that you're going to have more positivity. So, and I don't want people to get hysterical when they see the positivity rates going up, because if you open up more sites, you're going to get more positivity. It's an automatic outgrowth of more sites, which is a good thing. Also, the more positivity you get, if as long as people don't end up in the hospital, if you feel bad for a day or two or a couple of days, you feel like you kind of have the flu type symptoms, but you build up your antibodies and you build up community immunity, which is, by the way, a negative that turns into a positive. I tend to focus an awful lot on the hospitalization numbers, but in answer to your question, yes, more sites, more testing, and everybody will be doing that as well as we will be. We are opening up new sites right now.
Joe, is there anything you'd like to add about the testing?
Just with regards to testing, we continue to make testing available for not only our team members, but their family as well. You heard Michael mention before about some of the increasing rates amongst healthcare workers. That's no greater than we have seen in the past. Right now, within the last 7 days, we've put about 500 of Northwell's healthcare workers out on quarantine and leave because they have tested positive and they're symptomatic. As you also heard Michael describe, we are putting a heavy emphasis on booster. And I think this is one of those categories where, we oftentimes will procrastinate some of these things. And so what we're seeing over the last even just week is a very, very dramatic increase in the number of team members getting boosters. Just within the last day, we had over 600 team members get their booster shot. And so I think it's more just a function of people thought they had more time to go out and make the time to get the booster. And now, given the rise in Omicron, they're certainly making that time and that effort. And so we're going to continue to push as hard as we can to make this a requirement of employment within Northwell because we believe it's the right thing to do, as you heard Michael talk about.
Let me just add another thing. I think it's very important here to be optimistic and call for calm. The problem you have, you got 24-hour news, and anytime anybody turns on the TV, it's like problem. We are in a pandemic. It does require a lot of effort, and it causes inconvenience and some change that by people, and that's pretty normal. But at the end of the day, we will win against this. And I would just want to reiterate again that almost 80% of the patients that are in our hospitals, and I'm sure it's the same in Buffalo and in Rochester, 80% are non-vaccinated. They haven't been vaccinated, which makes no sense. Imagine what the numbers would be like if everybody got vaccinated. I understand people's arguments about why they don't want to do it, but it's illogical in my view, and I don't mind saying so. I think it's just illogical. Get vaccinated, and the likelihood then, if you are vaccinated, it doesn't mean you won't get COVID, but the likelihood of ending up in a hospital or in the ICU is greatly diminished. Why you won't do this, I cannot fathom. But in the meantime, we have to deal with what we have to deal with, and at the end of the day, this will be taken care of. The healthcare system is strong. Healthcare system will handle it. We'll deal with it. This is what we do. This is why we're in the business, and at the end of the day, we will succeed. So, no time for panic, and no time for creating unnecessary crisis. Healthcare will take care of it, as long as the public does what the public should do. And over the holidays, as I know that everybody wants to have large groups around the Christmas. The smaller the groups, the better. Somebody I saw in the newspaper today that somebody was quoted as saying that if you're in a group of 10 people, in all likelihood, one of them will be positive, but they yet don't know it. That's the reality that we're dealing with. But anyway, let me close by saying again, thank you guys for everything you do. Thanks to the staff in Rochester and in Buffalo. Thanks for being so accommodating to our people and for our people that have been up there. Thank you so much for doing what we know you would do to begin with. Thank you very much.
And
Thank you.
Michael and Joe, thank you for your time. I just want to let the media know that we are going to offer additional details on testing. We plan to open up sites next week. We don't have everything finalized yet, so the moment we do, we will issue a release making you aware of where the testing sites are and the hours of availability. Thank you all very much for attending today's press conference.
Thank you.